As many of us know, cats experiencing breathing difficulties can be incredibly delicate, and trying to monitor them without causing further stress can be a real challenge.
That's absolutely right, Brian. When a cat is struggling to breathe, the last thing we want to do is subject them to invasive or stressful procedures. Traditionally, we've often relied on simply counting their respiratory rate and making subjective assessments of their breathing effort. However, this approach has its limitations.
Exactly. Think about it. Just observing a cat's breathing might not always give us the full picture of how hard they're actually working to get air in and out. In human medicine, a measurement called minute volume, which is the total amount of air a person breathes in or out per minute, has been used to help assess the severity of breathing difficulties. But until recently, we haven't had a clear understanding of how this relates to respiratory distress in cats in a clinical setting.
That's where this really interesting study comes in. Researchers set out to investigate whether cats with respiratory distress would show higher minute volume compared to healthy cats, and if this increase could tell us anything about their chances of survival. They used a technique called barometric whole-body plethysmography.
Now, that's a bit of a mouthful, but essentially barometric whole-body plethysmography is a non-invasive way to assess a cat's breathing while they are in a comfortable, unrestrained chamber. This minimizes stress, which is so important when dealing with these fragile patients. The system detects changes in pressure within the chamber as the cat breathes, which allows researchers to measure various aspects of their ventilation.
So, they recruited 52 cats who were showing signs of respiratory distress due to various underlying conditions, such as lung problems, issues in the space around the lungs, or obstructions in their airways. They compared these cats to a group of 14 healthy cats that had been part of previous studies in the same laboratory.
And what did they find? Well, the results were quite significant. The study showed that cats with respiratory distress had a considerably higher minute volume per kilogram of body weight compared to the healthy control cats. The average minute volume per kilogram was 397 milliliters in the distressed cats, while it was only 269 milliliters in the normal cats.
That's a pretty substantial difference. And it wasn't just an overall trend. The researchers also looked at different causes of respiratory distress. They found that cats with lower airway obstruction, lung parenchymal disease, and pleural space disease all tended to have higher minute volumes per kilogram than normal. Interestingly, cats with upper airway obstructions had minute volumes similar to the healthy cats.
That's a key point, Andrew. It suggests that the underlying cause of the respiratory distress can influence the minute volume. The researchers even determined a cutoff value of 373 milliliters per kilogram. They found that cats above this value were likely to have abnormally increased breathing effort with a good level of sensitivity and specificity.